Welcome to this Nutrition Pearl, part 2 to the series on Pediatric Malnutrition Z-SCORES, presented by the Council for Pediatric Nutrition Professionals. Pediatric malnutrition, as defined by Mehta et al., is an imbalance between nutrient requirements and intake that results in cumulative deficits of energy, protein, or micronutrients that may negatively affect growth, development, and other relevant outcomes. Previous recommendations for classifying malnutrition included the use of percentage of ideal body weight, crossing down of percentiles, and weight below the 5th percentile. Current recommendations have called for a shift from the use of percentiles to the use of Z-scores. It's currently recommended to use the Z-score, decline in Z-score, and negative Z-scores to identify and document pediatric malnutrition. So how do we apply Z-scores in identifying and classifying malnutrition? Z-scores for individual growth points or for growth trends can be used in identifying malnutrition. Growth trends are preferred as they show change over time, but are not always available. As you can see, the negative Z-score and declining Z-score are used in not only identifying malnutrition, but also classifying the degree of malnutrition. The next few slides will provide some visual examples of the use of Z-scores. This is an example of using growth trends in identifying malnutrition. This patient demonstrates a decline in weight for length Z-score of 1.07 standard deviations from May to June. As indicated above, a decrease in weight for length Z-score of 1.07 fits within the range of mild malnutrition. Rather than stating that the weight for length decreased to below the 5th percentile, we are able to specify to exactly what degree the weight for length decreased by using the Z-score. This is an example of using an individual growth point to identify malnutrition. There are not any previous anthropometrics to assess, so the use of growth trends is not an option for this patient at this time. The BMI-for-Age Z-score, as noted on the slide, is 2.82 standard deviations below the norm, meeting criteria for moderate malnutrition. Rather than stating that the BMI is below the 5th percentile, we are able to specify exactly how many standard deviations this measurement is below the norm, which is 2.82. The use of mid-upper arm circumference, or MUAC, is another way of using an individual growth point, especially for patients with ascites, edema, and organomegaly that may impact weight. This dietitian obtained weekly MUACs on this patient using the same arm and the same method each time. When compared to the norms, the MUAC measurements indicated a Z-score of 3 standard deviations below the norm, thus meeting criteria for severe malnutrition. Thank you.